Greetings from Washington, D.C. This is Peter Thomas with the National Association for the Advancement of Orthotics and Prosthetics, NAAOP. The last Friday in November, the Centers for Medicare and Medicaid Services released some very significant information and policy changes on off-the-shelf orthotics. This is an issue that's been brewing for a few years now, and NAAOP has been working in concert with the Orthotic and Prosthetic Alliance organizations in addressing with CMS some very significant proposals to the orthotic benefit. This ultimately derives from the statutory authority that CMS has to competitively bid off-the-shelf orthotics. The statute that created the competitive bidding program does not permit competitive bidding of prosthetics or any other orthotics other than off-the-shelf orthotics. What CMS has done recently is greatly expand the scope of what it considers to be off-the-shelf orthotics. And eventually, if and when it decides to implement competitive bidding of off-the-shelf orthotics, we expect this to be a much more significant financial impact to the field than it would have been had CMS implemented the letter of the federal law. That's a problem, and we oppose that interpretation that CMS has promulgated. Nonetheless, allow me to walk you through some of the factors involved in this new decision. Just a year ago this month, December 2012, the Office of Inspector General published a report stating that the L0631 back orthosis code was being submitted for payment, and that in a sizable percentage of instances, no clinical care was being provided with that orthosis. That seems to have formed the judgment or formed the thinking of CMS officials as they've looked at this issue of which codes are to be considered off the shelf and which codes are not. We learned earlier in 2013 that CMS proposed to essentially examine a series of orthotic codes and determined that a number of those codes could be provided either off the shelf or with additional clinical care included. And what their proposal was earlier this year was to bifurcate those codes, or in their terms, explode those codes into codes that would only really require clinical care, and to create new codes for very similar devices that are covered by the existing codes, but where they believed little to no clinical care was necessary, and create essentially a whole new set of off-the-shelf codes. NAAOP, along with its alliance partners, went in and met with CMS. We met with the very key policymakers involved in these decisions and presented very strong arguments to oppose much of what CMS was doing. And ultimately, we learned just recently that, in fact, that advocacy has largely fallen on deaf ears. CMS is moving forward with its proposal. They have created 23 new off-the-shelf codes for orthoses that are currently described under the HCPCS coding system. And they've determined that some codes, about 32 codes, can really, are often now currently provided as both off-the-shelf or orthoses that require greater clinical skill that will now only be able to be provided by certified orthotists. By the way, the new guidance also suggests that not only certified orthotists can provide them, but also individuals with specialized training necessary to custom fit an orthosis. It's not clear what this actually means. It's fairly clear from the BIPA Section 422 language passed in the year 2000 by Congress that a certified orthotist is an ABC or BOC certified orthotist, or an orthotist certified by an essentially equivalent organization. But it's not at all clear what it is to have specialized expertise to provide a custom orthosis. So therein lies many of the questions. There will be implications to this decision. It's not immediately clear what they will be. We understand that CMS officials have suggested that competitive bidding of off-the-shelf orthotics is down the road, not anytime soon, but even that is unclear as to when that might go into effect. It's also unclear as to whether CMS will now go through a gap-filling pricing methodology to assign reimbursement levels to the off-the-shelf codes that they've just created. If they do that, you can be sure that they'll be discounting dramatically the existing code reimbursement values for those orthoses that are currently described by the HCPCS coding system. And it's no telling when those values may come out. Usually it takes about 6 months, but it could be sooner than that. So it's disturbing news. It may very well have implications on various delivery models that are currently in place and exist with respect to the orthotic field. And it's something that NAAOP and the Alliance organizations are working very diligently to try to correct. Thanks so much, and look forward to next month's update.